be demoing insulin or sub-Q injections. So, of course, you need to make sure that you grab the right patient. So check your chart to make sure you have an order. So I'm going to check the MAR. I have insulin due. I have 2 units of regular insulin as well as 2 units of NPH, so I have both my vials. I'm going to make sure that I wash my hands, bring my chart with me, and perform ADIP with my patient. Mr. Smith, my name is Erin. I'm going to be your student nurse today. Today I'm going to be giving you your insulin as ordered by your physician. Your blood sugar was a little elevated, so you're going to need 2 units of your NPH insulin or your long-acting insulin, and you're going to need 2 units of your regular insulin or your short-acting insulin. Where would you like your insulin today? We can do our fatty areas, which would be the back of our arms, our like love handles or the sides of our tummy, or even the parts of our tummy, and then kind of our thighs, so the meatier parts where there's more fat tissue. If you have a skinnier patient, it's going to be more likely to go in their tummy. We'll go over that. So Mr. Smith, it takes about 5 minutes or so for me to get everything ready, and it takes another minute or 2 for me to go ahead and give your insulin. I'm going to have you tell me your name and your date of birth. I'll have you check. Name and date of birth. Thank you very much. So everything's been done. I'm going to then get my medication ready. So check my MAR. So I've got my NPH and my regular insulin. I need 2 units of each. So I'm going to wash my hands and put on gloves. I'm going to clean the tops of my vials. I'm going to make sure I have the correct syringe. Insulin syringes will say on the package insulin only, and it will also say on your insulin syringe itself, insulin only. It is measured in units, so you need to make sure that it's the correct one. So I have the correct syringe, the correct medication. I'm going to go ahead and open my package and get it drawn up. When you mix insulin, which again rarely you will do, but you may come across this, we're going to take the cap off, and since I need 4 units total, I'm going to draw up 4 units total of air. I'm going to put air into clear, 2 units, air into cloudy, 2 units, draw up the cloudy, just 2 units, I'm going to draw up just a touch more to make sure I have enough and that I don't have any air bubbles. So I've got my 2 units. And then I'm going to draw up 2 units of regular. On the regular insulin, you really can't draw past your mark. Alright, so I've got my medication. I'm going to go ahead and scoop my cap, lock it back in place. I'm going to make sure that I've got 2 units of regular and 2 units of NPH. With insulin, it is a double check medication, so I need a second nurse to double check and make sure I've drawn up the correct medication. They would need to be there for the drawing up of both to make sure that you drew them up correctly. I'm then going to use or get my patient ready. So if I'm going, if they're a regular patient, you can use the back of the arm, their love handles, or their tummy, their thighs. If they are a skinnier, older person that doesn't have a lot of fat tissue left, you may need to go with their abdomen, and you're going to do just a 1-inch pinch. If they're a regular person or a obese person, you can go ahead and use a 2-inch pinch. So let's say they're skinny. I'm going to do a 1-inch pinch, and I'm going to go in at a 45-degree angle. If they're a regular person, again a 2-inch pinch, and I can go in at a 90-degree angle. So I'm going to go ahead and we're going to pretend they're a regular person. I'm going to clean the patient with an alcohol swab. So starting in the center and working out in a spiral, letting it dry and making sure that it's completely dry. I don't fan over the site and I don't blow on the site just to prevent any chances of infection. I'm going to uncap my needle. And I'm going to say, Mr. Smith, are you ready? They say yes. On the count of 3, I'm going to go ahead and administer your insulin. 1, 2, 3. And that's it. Engage my safety. And then gently blot if there's anything that it comes out. And then I'm going to clean up all my supplies, throw my needles in the sharps bucket, thank my patient, tuck them back in and make sure there's nothing else that they need, and let them know that if they do need anything, you'll check back in about 30 minutes to an hour, okay?